Reception's good? All right. Well, I'll give everyone that.
Thank you so much.
So this will be a little more kind of workshop-y, interactive, or like, not just us talking at you, but more with you. My name is Michael Yosef. I'm with Daley Strategies. I'm joined by Liam on our team and Paul Stansbury, who's our advocacy chair, and we handle all the advocacy and policy for NAMI GLAC. So just kind of a quick recap of how today's going to go. I'll do a quick. Sure, please.
Thank you all for being here. This is, as you sort of heard from Dr. Wells this morning, and they may have heard another workshop, this is very important work. This is what NAMI is all about. Part of it is to be advocates. We know the system is not working well, it's dysfunctional. There are lots of issues, and we have a lot of challenges today, lots of challenges. Funding cuts, reduction cuts, healthcare treatment cuts. So this is an important issue to deal with. We're very fortunate to be working with Daley Strategies and with the advocacy committees to try to address these issues to help us to focus our approach to be more effective as much as we can. So with that, I want to thank Michael and his crew, and also thank the advocacy committee. People who work with us. We need you to help us to achieve these goals with that. So thank you.
Paul, can I get a quick show of hands? Has anybody here been to our advocacy committee meetings? Yeah, we have a couple, one or two, maybe Debbie. So just for everyone's awareness, advocacy is a big, priority for NAMI GLAC, and the system is broken, and there's only one way to change it, and that's by engaging it. That's what this will be focused on. But we do talk monthly, first Wednesday of each month at 5 p.m. Paul and Mark lead that meeting. So if this is of interest to you, I do encourage you to sign up. We'll send the sign-up sheet around and have you join us because we need all your voices in the process. So that's my PSA before I jump right into it. So just to get started again, Michael Yosef with Daley Strategies. Want to recognize Mark Gale, who will be joining us in a few minutes. He leads criminal justice efforts. And then Paul Stansbury, our GLAC advocacy chair. Oh, you went the wrong way here. Sorry, one sec. Technical difficulties. Liam, can we?
Want to turn the main computer down?
Yeah, can I see the computer?
So linked on that first page. So if you go back to the one with the pictures,
Okay.
and then it should be a link. I think. You might need to exit out.
Charlotte, you want to take a look at it and I'll get going?
Yeah, of course.
So I'm going to go slideless for right now and I'll just talk through it. But again, first just wanted to recognize the NAMI GLAC team. Again, beginning of the session is really just going to be a very high level how-to on how to do government engagement. I really do hope you all join us in that process. And then we'll move on and focus the substance of this discussion on what exactly we're working on and how you can get engaged on those specific priorities. So, oh, there we go, Liam. Thank you.
Well,
If you want to I can tell you when to scroll that slide.
sure. Okay. Oh, sure. We'll see it.
Let's go to the key points slide.
Yep.
Excellent. There we go. So a few key points just to, hey, Mark.
Wonder.
Everybody, Mark Gale, our criminal justice chair.
Hello.
A few key points, as we talk about government engagement, and again, I'm going to run through this really quickly because I think what's more important is what we're actually working on. But elected officials work for us. Sometimes it feels like there's this completely different kind of other outside group of policymakers making policy that affects all of us. But at the end of the day, they really are members of our community. And they want to serve us. So it takes all of our voices here to influence that process. Another key point about advocacy, consistently, educate, engage elected officials. They require or rely on groups like NAMI and advocates like us to keep them informed of what the actual issues are that are impacting this group and what kind of policy outcomes we'd like to see. And then the last thing, government engagement is a process. It doesn't happen overnight. It takes a lot of work. I think Mark and Paul can speak to that. They've been at this 20, 30 years, and change happens incrementally. It doesn't happen overnight. So it really requires this group and this voice being part of that process over time to achieve outcomes. So again, the more voices we have and the more you all can engage with us, the better it is as we go through that process. And next, real quick, Liam, can we go to the mental health landscape? Understanding the policy landscape, just for a quick primer, NAMI GLAC, the Greater LA County chapter, is exclusively focused on what's happening locally in LA County. NAMI GLAC does have a federal chapter. They're very active on federal policy. We encourage you to sign up for their advocacy alerts and to get engaged with NAMI Federal if you're passionate about federal issues. There's a state chapter up in Sacramento that handles state policy and work. And then locally, again, there's NAMI GLAC handling local issues. So keep that in mind as you go forward. A lot of mental health policy gets set at the state or federally and then implemented locally. So it is this complex dynamic where all the different chapters are working with each other. Liam, can we go down? So again, just to recap that, the NAMI structure, it's a federated model. As I just explained, there's the federal chapter, the state chapter, and then the local chapters. And then within the GLAC umbrella, there are even the kind of hyper-local chapters within LA County, of which many of you are members, and we're grateful for that. And then, as we engage government, just a few lessons, keep the messages simple and consistent. Persistent communication and follow-up is what kind of leads to outcomes. And then relationship building. Politics is about people. It's about all of you. It's about your stories. It's about what's happened in your lives and how that can be translated into policy outcomes. So again, I just can't stress enough how much we need all of you in the policy process. So local government, where NAMI GLAC is focused, again, state policy gets set. Sometimes it's federal, but at the local government, we're oftentimes talking about implementation and funding distribution. I'll get into our priorities and the measures we've been talking about, but please know that we're closely tracking how state policy gets implemented in addition to kind of the local policy decisions. And, budget advocacy is key. We'll talk about Measure A and Prop 1 and some of the other, funding initiatives we've been working on, but that's really a huge priority for NAMI GLAC's advocacy team is how are we making sure that funding is going to mental health and mental health treatment and beds. Liam, if we can go next. So vision and goals. Now we're going to have a high level overview out of the way. We'll get into the substance here. NAMI GLAC really is the leading voice for the mental health community here on policy matters locally. And to the great credit of Mark and Paul and John and Trouty and the NAMI team, NAMI is looked at as that subject matter expert when policy decisions are made here in the county about, how to solicit and what the impact for the mental health community will be. So what we're working on is increasing our network of volunteers and advocates, developing pipelines of communication with elected offices and the NAMI GLAC advocacy team, making sure we have timely advocacy alerts that are distributed to the membership. So please, if you haven't signed up with us for our quorum alerts, make sure you're in our system and that we have your information because we do rely on all of you.
Can you pass that clipboard?
Absolutely. I was going to do it at the end, but happy to do it now too. Oh, thanks. And then Liam, if we can go to the next slide. Federal policy priorities. I'm not going to go through them all right now because again, NAMI GLAC, we're really focused on the local, but these are some of the federal chapters policy priorities. The state focus areas, again, we've got Proposition 1, which was passed a couple of years ago, a big housing measure to build more treatment and behavioral health facilities. SB 43, which is going to be soon to be implemented in LA County. Paul and Mark can speak to that more in a second on what they're doing to track that. Care Court, the 988 crisis response. And then Measure A funding again locally here. That was the sales tax measure passed last year. And we are advocating robustly for funding to go to mental health. So again, key priorities, more of them behavioral health infrastructure, advocating for the mental health workforce. Just gonna scroll through real quick. Criminal justice reform, we'll talk about all the work we've been doing on the criminal justice space and the Sheriff's Care Campus vision, of which we've provided a lot of feedback, breaking down the barriers between housing and homelessness, and then building out our advocacy network. So it's not just Mark and John and Paul and me, but all of you really engaging with us in that process. So I think, Liam, this is the section where we can go in our city and county focus areas. Again, I'm going to stray away from the slides here and have this be more of an interactive discussion, in part with John and Mark and Paul. But just want to talk about what we're working on. So Mark, do you want to start off maybe with the Care Campus and criminal justice initiative?
Want me to start?
Sure. Here,
Do you want me to stand or you can sit? Hey, everybody. How you doing? Good. Good. You ready to be an advocate?
Yeah.
Good. Let's do some work. So my son was arrested in November of 2002. And that's how long I've been at it. He got sick long before that, as with schizophrenia, at 13 or 14, which is unusual. It usually happens later in life. So we went through years and years without NAMI, without any help. We finally found NAMI, and he had substance use problems too. So we were involved with the NACA, AA, and we would go to these meetings. A lot of recovery in the room, but they're not dealing with what we're dealing with. And it wasn't until I found NAMI that I came home really excited for my first support group. And honey, I found it. And that's got me started. And the first thing that happened, I was in my family class. And my teacher was, some of you may know Jim Randall, he's one of my teachers. And I told my story about how my son was arrested, and I tried to call the jail, and I called over and over and over and over again, 45 minutes to an hour on hold, screaming and yelling, put me through to a doctor, and I couldn't get a doctor on the phone. 5 days, 5-6 hours a day on hold. Couldn't get a doctor on the phone. Had no way to get this done. And Jim says to me after I told my story, we happen to have a meeting with Commander Klugman down at Twin Towers next Wednesday. You want to tag along? He said, we're gonna do a continuing education program for custody assistants and sheriff deputies at the jail. This is before I even knew what CIT was, Crisis Intervention Team Training. I said, yeah. So they did their pitch. The other NAMI members are there. And I told him, he says, told him my story. He says, gee, I'm really sorry that you can't get a doctor. What do you want? I said, I want 24/7 access. So families can send medical and psychiatric information to the clinicians that work in their jail. He says, we can't do that. I says, why can't you do that? I said, you have a fax machine, don't you? He says, yeah, but it has to be in a secure area. So I stayed on him, and we'd go to meetings with the chief, and I'd stay on him. And 6 weeks later, I'm at work one day, and I get a phone call, and it's him. It's Commander Klugman. He says, you got a pen? I said, what's that? He says, here's your fax. All right. So then I developed the inmate medication information form. And maybe some of you have used that form, right? Where you can fill in who the treating psychiatrist is in the community, your contact information, diagnosis, medication, dosages, suicide, all that kind of stuff. That happened because my kid got arrested, and I got really pissed off because I couldn't get a doctor on the phone. And then Carla Jacobs, my mentor, and Jim Randall and I wrote a little ditty called My Family Member's Been Arrested, What Do I Do? That's how I got started. It was direct involvement because there's something that happened to my family. I could not. So we all recover in different ways. I cried every day on my way to work. I cried home. I'm not going to here to get into my story, but I stopped crying every day because I couldn't fix my kid, but I could try and fix the system. That was my recovery. So the dirty little secret of advocacy is we do it for ourselves first, And then it's wonderful that it helps other people too, but I had to do it because that was the only way I could recover, okay? So someone, actually a selfish exercise that also helped other people. And then I got hooked on it and I wanted to learn more. And I had a great mentor who said, well, you're gonna have to get to work. So I started reading. And you know, if you want, there's lots of ways to be an advocate. You can show up at a Board of Supervisors hearing and we'll hand you a script and 5 talking points and you only get 60 seconds, as we found out. And you can show up, because one of the things I hear all the time is, Mark, we've been seeing you for 20 years. You're always here. Where's your membership? Where's NAMI? You're the only one here. And oftentimes in many county meetings, I'm the only mental health advocate on the call. Or maybe it's me and Trouty, or me and Paul, or me and... Where's our membership? So we need numbers. We got to show up. It makes a difference. They go, you show up. We were there for the CSIT report, the Community Safety Implementation Team, which is working on closing the jail. And there were 20 other organizations, about 30, 35 people, all going to talk about how they didn't want to build a care campus, and they, you know, and they didn't want to give the sheriff any money. And, you know, it's sort of the abolitionist community. And they're all great people. And by the way, a lot of stuff they said we agree with. You know, they make a really strong point until we get to the point where the other issue in the county is they want to close Men's Central Jail. Now, so do we, but they offer no alternative. So I'm gonna focus on the present. We want treatment, regardless of setting. In my phrase for 20 years, it's our North Star. And so what does that mean? It means that in order to close Men's Central Jail, we got to get the mentally ill out of the towers and put them where? That's the problem. I call it a therapeutic environment. What does that look like? I'm going to take a couple of years to develop some kind of concept. I mean, I can sit here and expound on this, and they've already shot down my original idea. So so that's what we've got to figure out is, if we're going to move the mentally ill out of jail cells, what should it look like? So anybody who's ever had a family member in a state hospital, it's a secure perimeter, but it's a clinical facility inside a secure perimeter, right? So they're in rooms, not cells. There are doctors and clinicians. Yeah, there's security, but the main hospital police, right, are on the perimeter, not inside. There's other security. Something similar to that kind of a concept. Remember, these are people who are incarcerated. So the big problem in our county is, well, why can't we just get them out? Well, a lot of these people are extremely ill. And not just the ones who've committed felonies, really serious felonies, who can't get out at all on diversion. They're non-divertible, you know, but there are people with serious charges. They need treatment too. And if you can't discharge them to the community, because the DA and the judge would never allow it, right? They may be serving 3 years in the county jail. They have to serve the 3 years because they're non-divertible. Why? Charges are too serious. The DA's not going to let them out. So and in many cases, some of these people have committed dangerous offenses. You know, there's victims too. So they're going to have to be accountable and finish their sentence. But they're not getting treatment in Twin Towers. So if we put them somewhere, it's got to be safe. It's got to protect public safety. That makes the judges and the district attorney exhale. Oh, okay. They can't hurt anybody. They're not in the... It answers the question of public safety. Our question is, okay, how do you address the public safety issues, the legal issues, and at the same time provide treatment? Can't provide treatment in a jail cell. So that's what we've got to figure out. We came up with some ideas. We have a short-term and a long-term program that we can envision. Short-term program is depopulate the mentally ill out of the jail as quickly as possible for those who are eligible for diversion. And for those who don't know what diversion is, we're going to divert somebody from the criminal justice system to the healthcare system, right? From jail to a residential treatment facility in the community. So there's 10 guys in a home, overseen by ODR and clinicians, put people there, they're in the community, and under the terms of their diversion, which for ODR is post-plea, Some people will get released on diversion pre-plea through the mental health diversion statute, totally different statute, but they're going to be getting treatment and linked with substance use disorder services, mental health. But what do we do for the guys? That's a short-term program. Judges have said to me, I get people in my courtroom all the time, they're eligible for diversion, but I can't release them, they're too sick. So I said, well, if they could be stabilized before they were released, would you release? She said, I had a judge say to me, I'd kill to have a program like that.
Wow.
They're just too sick, but if we could, so what does the mental health system do? We set people up to the level of care they need, and then when they're stabilized, we step them down, right? So if they need acute care and they're LPS, they meet LPS criteria, we stepped up into an acute level of care. And then maybe if they're conserved, they'll go to a subacute level of care in a residential locked facility where conservatees are detained for treatment. And then when they no longer need to be there and are ready for community reintegration, we step them down to ERS, Enriched Residential Services Community, a higher level of residential treatment than a board and care. And then maybe they're ready for a full service partnership. They can leave there and go to an FSP. And then eventually outpatient treatment utilizing the clinic. Those are the multi-tiered, that's what we do. And the way we do in the community is we build essentially restorative villages with all those levels of treatment all on one site. Somar, MLK, right? The different areas of the county, now they're building it at LA General. Why can't we build something like that within the carceral system as well? So people who can't get out still get quality mental health care while they're there, because everybody comes home someday. If you committed a crime and you were untreated and you remained untreated in jail because you refused treatment and you're discharged untreated, what's the likelihood you're going to recidivate and be right back in jail 4 months after discharge? That's what we want to prevent. And that's why the population of the jail every year keeps going up. The mentally ill population. Because there's a base that continues to recidivate, and then new cases and young people pile that up, and that's why now we're 7,500 instead of 3,000 or 4,000 or 5,000. So we're talking about short-term programs that can depopulate the jail, stabilize people, discharge them to ODR, get them out of the jail, and let them, because in diversion, if you complete your program, your charges go away. In the case of mental health diversion, they evaporate as if the crime never occurred. If it's post-plea, you'll have a record, but you're back in the community again. So these are the kinds of concepts we're talking to the county about. Let's provide good mental health care, multi-tiered levels of care. People can be stepped up and stepped down as determined by doctors, not custody, and get people well. Treatment, regardless of setting, that's what we're fighting for. Yes.
Are they going to make it easier to actually have LPS, like conservatorship and stuff? Is it part of
In the jail?
Yeah, in jail.
So we have 33 beds, which now is getting up to over 50. In the FIT, the Forensic Inpatient Program, is the LPS designated hospital at the Correctional Treatment Center down by Twin Towers. All right, but that's the actual acute care hospital in the jail. In some instances, if somebody's ready to be discharged and they are gravely disabled, it is possible to petition for conservatorship services prior to discharge. I'll tell you, I've never done it, but I know people who have. To get somebody who would go into a hospital in the community direct from jail. So it can be done. It is legal to do it if they meet criteria.
I would say because we have in my work, I work for permanent supported housing, we do have a lot of clients that need conservatorship because they are higher level needs, and then we keep going into like a wall because it's hard to even get them to that point.
I mean, conservatorship is really hard to get. I mean, and that's a resource problem, a legal problem. Senate Bill 43, which will be coming into existence January 26th, in January expands the criteria, so more people would be eligible for conservatorship, but it's really difficult to get.
Mark,
but I don't want to dominate. And
no problem. I appreciate you talking about what got you involved in advocacy, and a high-level overview of what we've been working on in the criminal justice space with the Sheriff's Care Campus. But for this group here, I really want to stress that we need all of you to join us in our advocacy efforts, especially on if this care campus and criminal justice reform resonates with you, or you've had family members who have been through this system. This is a really complicated and tough issue at the county, and we need more voices with us. As Mark mentioned, we went to the Board of Supervisors last week, and folks who are opposed to this kind of vision are certainly mobilized.
There were 35 of them.
Yeah.
You know, and so someday there was no motion on the table. It was a report out. Someday, 18 months from now, 24, whenever it happens, there's going to be a motion on the table to authorize construction of something, we hope, if we get our way. And that's when I need all of you and we need all of you to be there, because we need 35 people who are willing to drive downtown, sit for 4.5 hours and wait to do your 60 seconds. That's what it is. And it's work, and it's not fun at all. But if it's only 2 of us show up, where's the power? If 30 of us show up, we brought NAMI with us, okay? That's where the rubber meets the road.
Absolutely. And that's just one of many issues we're working on, by the way. I just want to highlight a couple others. I'll do one in the justice space too. You know, in the Twin Towers, there's a mental health assistant program where they actually have trained peer inmates who are embedded in pods with those experiencing mental illness, serving as kind of peer mentors, peer support specialists. That program's been really effective. So NAMI, we've been advocating to see that program expanded in the jail system, and certainly kept at a baseline, but also expanded. And then again, you know, I think Mark can speak to it, Paul can speak to it, but NAMI's North Star when it comes to justice in the criminal justice system is really treatment, regardless of setting, and making sure that folks, whether you're in custody or you're out in the community, that you have access to the best possible treatment. So we're keeping our eye on that and making sure we're advocating for better treatment in the jail system, because it's certainly broken right now. Mark, before we move on to other issues, anything else justice-wise you wanted to bring up that we're working on?
Oh, God. There's so much to work on. Right now, the focus has really been in trying to get a care campus model in the heads. And that has entailed meeting with every supervisor's office, in some cases the supervisors personally, as well as their staff, meeting with Assistant Sheriff Paula Tokar and Sheriff Luna. I mean, this was Luna's idea. We were in a meeting with Luna. He says, I got this idea. Call it a care campus. Now they're calling it a correctional care facility or something, you know, and it's going to morph 5 times before, and it's not real. And we're going to be the lone voice in supporting it. And it's not exactly politically correct to agree with your sheriff, right? People like go, what? You know, you're agreeing with them, but people need treatment. So we know we're going to take heat from other advocacy groups and they don't care. Let them come. We really believe in this, and we don't know what shape it's going to take, but that's really been our focus. We also pushed for more ODR funding. ODR is capped in April, folks. We've gone from 2,200 beds to 3,615. Come April 26th, there's turnover and attrition of 70 beds a month. That means only 70 people a month. All right, in a county of 10 million people will have access to ODR, post-plea diversion, because without new money. So we're gonna have to go to the supervisors and say, please give the ODR more money. They're already at like 400 million, 500 million. It started, I was there when we started with 130 million. I'm on the permitted steering committee for ODR. Been there for 10 years since inception. And they shut it down for 2 years, and then we got it open back. And then there was COVID and that, you know, but in order to build it, have 5,000 beds instead of 30, we're going to need all of you to be loud. So there's lots and lots of issues. Yes, sir.
Right now, I know that California Department of Correction, the organization is utilizing California model, which is to address the stigmatization of criminalized behavior and the interactions that they have with custody, to stop the resistance that they have with the with the label of convict and the label of authority. Is there any way that we can compare and contrast and actually like jump onto that one? Because that's actually being implemented right now with the general population, where they've already created positions of peer support specialists to be able to work one-on-one and tackling all the areas of the special population. So, I mean, what I'm seeing here would be more that the reason why there's more pushback would be because of the high cost that it would take with medication and more actual direct care with people who aren't able to cognitively understand.
I was really involved with CDCR for 3 years when I was on the NAMI California Board of Directors from about 2009 to 2012, when Sharon Once was mental health director for CDCR. Anita Fisher from San Diego and I were, created a family work group, family connection work group, where we wanted to connect families with NAMI prior to discharge and put them through family-to-family classes and, do a warm handoff at discharge. And the clinicians loved us and wanted to rewrite the mental health program guide, which are their legal protocols, and custody killed it. And then when Sharon left, all that work dissolved. So at least now DMH, the parolee outpatient clinics were a disaster. Parole's been a disaster. Now at least DMH provides reentry services for people who need mental health assistance, but they're tough. We do have one affiliate out in Chino who are doing peer-to-peer. Is it NAMI Pomona Valley, I think, is doing peer-to-peer connections in Chino prison. And because another woman did that many, many years ago, they're picking up the program. So we're making inroads in that one prison.
And Mark, I'm gonna just pivot real quick because, the justice advocacy work is important, but we also advocate with the Board of Supervisors, with DMH, with others on a whole host of other issues. So just want to recap a few of them, and then I'll turn it over to Paul as well to talk in more depth. But Care Court, I think many of those here are familiar and know that NAMI was incredibly supportive and instrumental in getting Care Court passed and up and running. What we've been hearing from the county is that it's really only NAMI families, or the vast majority of utilization of Care Court has been from NAMI families. So we're working with the county to advocate for enhanced trainings for law enforcement and other folks who can refer into Care Court. We'd like to see the utilization rate of others into Care Court much higher. So that's been one of our priorities. And then again, with all the funding changes and quite frankly, challenges happening right now, allocating for Measure A and other county dollars to be spent on mental health, breaking down the barriers between homelessness funding and mental health funding. And then Proposition 1, which was passed in California 2 years ago now, dramatic changes to the Mental Health Services Act and now the Behavioral Health Services Act. So we're trying to ensure that critical local programming is not cut with that. And I know, Paul, you've been tracking MHS.
Yeah, I want to follow on a couple of things, but Dr. Wells' comments and Dr. Bond's comments this morning. We have a national issue with the Medi-Cal, Medicaid issue, which will affect lots of issues, which we need to be following. Now, as we said, we deal with the local county. NAMI National is helping us to provide input for the national pictures. So you may, if you sign up, we hope you do sign up, you may get from NAMI National requests for letters of support, letters of trying to address certain issues. Please respond to those. We will then, from our local thing, we also have a process of what we call quorum to send out requests for appeals. So if there's an issue at the county level that we need your support on, just for write-ins, in addition to showing up at places, we need you to sign up and show up and make those letters. I know you get lots of appeals online, but if you see a NAMI appeal, please respond to it and write to your local elected assembly person, local state senator, because this is happening. What's happening is we're seeing in this process right now, the Department of Mental Health is planning for implementation of the Behavioral Health Services Act. That's going to happen in July 1 of 2026. They're starting things now. They're planning things now for peer specialists, for all kinds of different programs. Now's the time to make your input. They have planning groups at all the different service areas. We have 8 service areas in LA County. You're one of those. They have meetings once a month where you can participate and you can provide input You can tell about your story, about your issues, and where you have input with that. So we hope you get involved in that. We can help give you information about those service areas. I'm in South Bay. We have a service area meeting the first Friday of the month. Rick Polito is a co-chair of that process with that. He can tell you about that. So those are times an opportunity for you to get involved. Now, because what's happening is they're planning for programs. They're trying to decide what to support, what to reduce, what to cut. It's a tough time for the county. It's a difficult decision because of the national programs that they're trying to reduce funding for a lot of issues with mental health. We need more treatment. Whether you're coming out of jail or you're coming out of needing help, one of the problems, we don't have enough treatment, we don't have enough housing. And so we need to advocate for those to make sure there's enough treatment, there's enough housing for our loved ones to be able to get the help they need. Process with that. So in your thing, you see the Behavioral Health Services Act. There's lots of information available on the NAMI GLAC website. There's a lot on the Departmental Health website, and also you can participate with that. Also, just getting the other issues, and the other one you heard about a little bit was Senate Bill 43. There's some programs coming up to be implemented January 1st this year. That's another opportunity for us to try to make sure it happens. That may be a way to get people, if they need conservatorship, to get conservatorship with that. But it's not a slam dunk, and they still need to get treatment with that. So we see there's a lack of treatment. We don't want anybody left behind. Everyone can check their needs. Like any other illness, they need to get the care they need, when they need it, how they need it, and process with that. That's not happening, and you know it. So we need to work to that. It's going to be a tough road, but so this is a way to help focus us. So it's help us to understand these issues. And if you go to a local meeting with your assembly person to have a coffee, hey, this helps you to know what to talk about, what to say. Here's what NAMI's about. If you have a coffee with a cop, they're getting better about having local meetings with the police officers, the law enforcement, or your local mayor, whatever it is. Be informed, take these issues and be able to talk about them. And if you need to get more information, you can contact us with that. So I think we're just trying to make sure we're focused as much as possible. It's a pretty overwhelming system sometimes. This helps us to try to be more focused on what we can achieve with that. With that. Yeah.
Yeah, I want to add just
Yeah.
one thing on what Paul said about legislation. You get an email, it's from NAMI National or NAMI California or us, NAMI GLAC. And now we have the kind of software. So it says, Senate Bill such and such is on the table. NAMI California sends you an email, write a letter and you go, hey, it's 9:30. I just finished paying the bills. I want to go to bed, but it's really easy because the support letter is already written. There's a little box that says, add a few sentences about your personal story. So you write 2 or 3 sentences that you'd like to say, and it's added to the form letter. And you put in your address and the software knows who your representatives are. So you don't even have to look up your legislator. And you click submit, you're done. So you write a paragraph, submit, I support. That's how simple it is. And for every letter they get, they figure there's 99 people who don't do it. So every one is 100. So that's how the system works. So it's really important that you do things.
Add on to that, and I'll get to your question in a second. I've worked in kind of the state legislature as a staffer. I think there are others of us who have as well. And we do notice, when a lot of letters come in on the same issue, one, it's noticed, and two, it shows that groups are mobilized on a certain issue. So it matters. We do have a system, as Mark was mentioning, called Quorum that's recently up and running for NAMI GLAC. It's really quite simple, as Mark said, as long as your address is in there, it'll map everything for you. It'll get your correspondence to the right offices automatically. It's really maybe a 2-minute process when these issues come up. So please do keep an eye out for that.
Michael, when we do our advocacy committee meetings, do all members get the invite or only a selected list who signed up?
So we recently switched it to all members getting the invite, but we also have people tagged. If you're really interested in advocacy or criminal justice, we tag that in the system.
Or if somebody's not a member yet, we can add an email to it. Okay. So make sure you're a NAMI member, because then you're in the database. And first Wednesday of every month at 5 o'clock, Paul Paul starts the meeting at 5. It's a Zoom meeting. You don't have to drive anywhere. And Paul will do advocacy on lots of different subjects for you. And then I'll follow with a criminal justice session at the end.
And of course, coming up this November, we have a special speaker. So we'll have special speakers about different topics, which are very critical at this point in time. And why don't you tell them about it?
Yeah, so this upcoming meeting, I think it's November 5th or November 3rd, whatever the first Wednesday is of November. And we're going to have Sarah Mahan join. She is the incoming director of the county's new homelessness department. So there's a brand new kind of department that LA County is creating to really break down some of the silos, we hope, and address kind of the homelessness on our streets in a more comprehensive way. And she is the new director, and she'll be joining our group to answer questions and talk about what her vision is for this new county department. So hope you all can join, and please, if you haven't yet, sign up on that sign up sheet so that we can make sure you're in the system and you'll get those notices.
How many times you've been in a NAMI meeting and said, housing is the real issue here. Housing is, show up first Wednesday. She's the point person for the county. All right, so we're trying to give you access to key people.
All right, well, we talked a lot about our issues. I want to make sure we have time for Q&A in case people have questions. And also, this is a forum where I think it also helps us to hear what are the policy issues that you all care about. We'd love to kind of go around the room and just talk with you all now. I know you had a question.
Sorry, it's okay.
Sure.
Working in peer support, a lot of other people, I do IOB and I do peer-to-peer. And there's so many great organizations, and being out in the community, finding out how many people don't know about NAMI or don't know about Project Return, or so many places are individually doing so many good things, but the connective tissue between them to get exposure out to the greater community is, between the people I know, myself, is lacking, and it's easy within those systems to get word out about things, but how to get more people in, how to get, I learned about NAMI from stand-up. I actually just happened to mention it. I was like, let me just look into that. What's the best way, in your opinion, to get this information out to people who aren't yet in this space?
Yeah, no, I really appreciate that question. And it's actually come up a lot because there are a lot of coalitions out there for other issues, homelessness space, housing space. For mental health, not so much, especially here locally. It's something we've talked about, and we're working on putting together kind of a broader coalition for policy advocacy. That's been in the works, but I would highly encourage you, and if we really do rely on all of you to spread the word about what is happening in the NAMI community. Invite those folks to our criminal justice and advocacy committee meetings. Those are open to the public.
Just shout out their jobs.
Yeah, exactly. I mean, I would just encourage as many people who are interested and passionate and want to engage this issue to join us.
I know so the Los Angeles Regional Reentry Partnership, if you know about LARC. Okay, so I've done some work with LARC, and LARC has some pages online, and of course they've got an organization, somebody's updating the site, right? And there's lots of reentry services. And if you look at their services, even though they're also have people with serious mental health, there's nothing there about mental health. Likewise, we're all separate mental health organizations, but there is no one site that says, here's all the mental health organizations. We don't have that. They do, but they're not connected with mental health. And frankly, sometimes we need reentry services and we're not connected with reentry. So it's really a kind of a macro issue, but worth discussing.
Yeah, that's for some of us, because doing peer support, whether you're in justice involved or you're a parent partner or whatever you're doing, finding a way to connect to other organizations will be a great resource, because you always need to be building resources. So you can
and if we can get past the issues where the mental health organizations disagree on the law or disagree on law, that's oftentimes the start.
So Michael, I just want to say on behalf of NAMI, as we have been discussing these matters right now, thank you for your lobbiness and your work that you're doing directly for all of us here at the grassroots level. Dr. Stansbury, I'd like Dr. Stansbury to just expound a little bit on our efforts that we're doing here in the South Bay, Dr. Stansbury, how we do our advocacy with SALS, with BHSA, CPT, downtown, and the rest. The folks should, like you said, for a minute, Dr. Stansbury is very humble, but he works very closely with housing. And we talk about beds. And I think that's the key issue to what Brother Mark's saying and the rest of us need is we just don't have the beds for our loved ones that are coming out of the joint or coming out of some of the community, lockup facilities. So Paul, you want to say a little about grassroots?
What are you doing?
I think just grassroots housing, kind of.
Well,
Beds and stuff we talk about all the time.
well, I think just, the only thing I think I really want to say is that NAMI got started by people like us getting together and deciding we had to do something. And that's whether it's housing or criminal justice or so forth, that's how we're going to have to make a difference, is getting together. And I think we have to be informed. I think the main issue here is these are complicated issues. But I think we're trying to sort of narrow it down to things that we can really focus on, understand, and have a good, effective message with that. Housing is one of that. We know that's been a process with that. We actually helped to get started LARCA. LARCA is a association of boarding cares, adult residential facilities and so forth. We're hoping to get them better funding and so forth. So they're on their own now. They're moving along and so forth. We need to do more things like that to help things get started to have a product. And that's in terms of advocacy with issues with that. But treatment, I don't know if we can say enough about treatment with that. In many cases, psychiatrists, social workers, they don't take insurance, any type of insurance. Who can afford? I mean, how do you afford that, especially with the current with that? So, and if those, and then many don't take Medi-Cal. So we have a real challenge of people trying to get health care. And so therefore.
If you have to go to a provider to pay yourself, it's $200 to $300
Oh, there's,
around.
yeah. So I think that's going to be one of our main issues is that how to make sure people continue to get treatment, how they get treatment, and that and I think there's a workshop this afternoon more about that, which Debbie, who's an expert in the area, will try to help address. So it's going to be a major issue for us this coming years with that, with that.
I'll just add on to that, Paul, which is why this group, this forum is so important. These policy issues, especially in the time we're in right now, are changing really quickly. With the federal administration and kind of budget cuts and all that's happening, we're really in uncertain times. So we rely on hearing from all of you what's going on the ground so that we can do our part and convey that to policymakers. Yeah, did you have a question?
And pivoting to that, is NAMI going to have a 2026 advocacy day at the local level for the county? And do you guys have a more or less of a date for a month?
So I appreciate you bringing that up. We just did our first annual advocacy day here at the county. It was in early September. So we did 2025. I think we all agreed it was successful, and we're hoping and planning to do that again. I think the timeline will probably be around the thing, late summer, early fall.
Most supervisors and staff were very interested and responsive to what we suggested, and now we'll have to see that happens.
Yeah, and I just want to give, Debbie, to that point, Mark, my takeaway, we discussed this. We did that advocacy day. The team has been advocating for this criminal justice, care campus, sheriff's division for a while. And this last board meeting, I think there was a noticeable softening or an openness to something like this vision. And that's not to say this is solely because of NAMI, but certainly NAMI's voice contributed to that. And it was just, you can get people to move, and it just takes time and effort and work. And I think we're starting to see that a little bit, hopefully.
We saw a shifting where it was a hard no. Now it's like, well, maybe we need to rethink this. So just a sentence here, a comment there, because, once you get into authorizing motions, you're counting votes. So we think we have 2, we need 3, but no names. But it's sensitive and politically, people have staked out political turf, and they have other constituents that would disagree with them. So, and disagree with us. So, it's a political process. But that's why we got to save democracy, right? This is democracy, for God's sake. You go down in a county and you tell them what you want, you tell them what you think, and you tell them what you think they ought to do.
Yeah.
And they can listen or not listen, but you don't get thrown in jail because you express your opinion.
Right.
And advocacy is democracy. I'll stop there. Get out on the street every Saturday in a march, for God's sake.
Right.
And on that point, I'm just saying we're after. We have Sally Malone, who's vice president of health government affairs, that used to be supervisor of mental health deputy. Sally, can you share a little bit about just what the perspective is when you're the health deputy in the supervisor office and what grassroots advocacy does or means?
Well, I'll really underscore that when you have folks show up, we are all up in the 8th floor watching. And we all know, we said, okay, we got constituent deputies get down there. What are they saying? What is their issue? It really, and it resonates. And we talk about it later. All those folks that came in, what were they asking about? And so there's the more nuanced kind of policy discussions too. But once you get their attention, we got people for that. But it's getting that mass attention, saying this is a big issue, because you're all constituents as well, right? They work for you. And they are very acutely aware of that. Now, it might not feel that way when you're going to this big fancy building and you have to go through security and but they know that they work for you. So showing up in numbers, writing the letters, filling out that all really makes a difference to staff who get it. Because then you say, we've just been getting a lot of these and they're terrified of ignoring. And that is empowered. So when you empower yourself, that scares them in a good way.
Mm-hmm. Great point.
Well said.
Are we out of time? I think so.
Yeah.
I think
Now
it's
we have
lunch.
enough.
I gotta let people eat lunch too.
You have 7 minutes.
A couple,
7
yeah.
minutes.
Do we have more time?
7 minutes.
We have 7 minutes, yeah. Any other questions?
Woman in the back there. That's good.
I actually am a part of those people that do work to abolish jails altogether. We've dealt with things without cops and things that you might be surprised that we've handled without cops. We've handled abuse, we've handled SA, robberies, drug-related things. We've done it without cops. So I myself am justice impacted. And I'm just wondering, what is your advice for creating a justice system culture that centers people care instead of people punishment? Because I do believe that.
Could you repeat the question?
Oh, yeah. What is your advice for creating a justice system culture that centers equal care instead of equal punishment? Because I have seen it done, so I'm wondering in what ways could it be done at a higher level? Like I myself am justice impacted.
I'll address that.
Kind of thing.
So we're a country of laws, and if you break certain laws, there's accountability. If you murder somebody, there's accountability. If you create a victim, all right, through violence or aggression, there's accountability. And, I'll give you a perfect example. Read Penal Code 1001.36. That's the mental health diversion law. Forget about ODR for a second, okay? That's mental health diversion. Anybody can access it if they meet the criteria in the law. And the law states these certain crimes, which is mostly involuntary manslaughter and murder and sexual offenses, are ineligible for diversion. So if you commit one of those offenses, you're not eligible for mental health diversion. You have to serve your sentence, okay? I'll tell you something else. I have so much respect for that community of, they call themselves abolitionists or, Justice LA, all the different programs. We have great advocates and they make great points, okay? 38 people have died in the jail this year. And they brought, they screamed loud and clear at the hearing about that. And they're right. We don't disagree with them. But their solution was, let's close Men's Central Jail. Now, just close it. Well, there's nowhere for those people to go. There's another thing. There are 368 people with serious mental illness in Men's Central Jail. If we could close Men's Central Jail tomorrow, all the towers and detention center are filled with people with mental illness. It does nothing for NAMI's folks. If we close Men's Central Jail, 368 people will get out, right? But we've got another 5,000, 6,000 people with serious mental illness in the jail system that aren't in Men's Central Jail. So just closing Men's Central Jail because we wish it didn't exist. And by the way, I've toured it plenty. I want it gone. We all want it gone. It's barbaric and horrendous. We believe the only way to do that is not just to demand closure, but they offered nothing in its place. We're offering something in its place. Take people who are sick and put them somewhere where they can get well. Even if it's within the carceral system, even within, and it has a secure perimeter for public safety risks and because of charges, which you can't evaporate, right? And anybody eligible for diversion, you bet, fund it full bore, as much as needed. I'd have ODR have 7,000 beds and double if we could find the money. Everybody who's legally divertible should be able to get out, right? But for the people who can't get out, should they stay in a cell or should they get treated? I say they should get treated. Yeah, that's where we're at. And we're willing to sit down with all the people who disagree with us anytime and have a real conversation. Not throw food at each other, but have a real conversation.
That's awesome, thank you. Yeah, I just wanted to know what strategies you're using to address the mental health care to prison pipeline. Unfortunately, that's a real thing, and as a mental health care provider myself, I definitely see that as a barrier. So I just wanted to know where y'all are at with that.
Yeah, I mean, when I owned my first home, I was robbed 6 times, and nobody was ever caught. But I'll tell you, I was pretty angry. Okay, I mean, we bought our house, and the first Friday we came home from work, my wife called me as I was leaving work, and she says, "You'll never guess what happened. We've been robbed." I said, "Already?" I mean, we just closed the mortgage. So, yeah, I wanted those guys put in jail. Never happened. They never caught them. But our position is we're not criminal justice advocates only. We're mental health criminal justice advocates. So we understand that mental illness severely impacts decision-making, impaired judgment, lack of anger control. There's all these different symptoms that the system sees as behavioral choices, but a psychiatrist would see as symptomatic. There's a difference between behavior and symptoms.
One sec, I'm just gonna add real quick to Mark's point. Our position is not, what does a jail look like? Our position, that's really beyond the purview of what our expertise is here. I think we're in full alignment with you, which is we don't want to see anyone with mental health recidivate because of their mental health issues. It's about getting folks either in custody or out in the community the treatment they need to address their mental health and mental illness issues. And that's really what NAMI's North Star is. We always say it's treatment regardless of setting. If you're in the custodial setting, we want people to get the treatment they need and deserve. If you're out in the community, we also want people to get the treatment that they need and deserve. That's really where we fall on this issue.
And we realize there's gaps and gulfs between different perspectives of view. And what we need to do is talk.
When did you have a point you wanted to bring up?
I was just going to echo what you were saying, Michael. And I think in your question you asked, how can we build a system that prioritizes care over punishment, right? And that's exactly what I think NAMI's vision is that absolutely when folks are able to be treated in a community and get that care without cost, as you mentioned, that is the goal, that is the North Star. But we also want to ensure that for folks who are in the justice system, that it's not a similar punitive model and that they're able to get that care in the system as well. So I totally, what you said and echoed a lot with, our vision. It's a thank you for sharing that. Thank you.
All right, thanks everyone. Sign off.
Sure, I'm doing better.